Hi, my name is Dr. Brad Fackrell from Synergy Spoke. And in today's video, I'm going to be talking about how high blood sugar and inflammation is a preventable underlying cause of virtually all chronic illness. This information is from an article in 2019 in JAMA, the Journal of the American Medical Association. Now, of course, the link to the article will be in the description of this video, but here are some quotes from the article. One of the most important medical discoveries of the past 2 decades has been that the immune system and inflammatory processes are involved in not just a few select disorders, but a wide variety of mental and physical health problems that dominate present-day morbidity and mortality worldwide. Indeed, chronic inflammatory diseases have been recognized as the most significant cause of death in the world today, with more than 50% of all deaths being attributable to inflammation-related diseases such as ischemic heart disease, stroke, cancer, diabetes mellitus, chronic kidney disease, non-alcoholic fatty liver disease, and autoimmune and neurodegenerative conditions. The prevalence of obesity in Western countries has increased in parallel with the prevalence of biochemical parameters, suggesting chronic inflammation. Now, consistent with this, individuals with obesity have higher mean levels of inflammatory biomarkers. Although the explanation for this observation is difficult to ascertain, there are multiple inflammatory conditions that are associated with obesity, including type 2 diabetes, heart disease, chronic kidney disease, cancer, asthma, gastroesophageal reflux disease or GERD, psoriasis, and small intestine bacterial overgrowth. When considered individually, in participants of both sexes, severe obesity, evidence of systemic inflammation, and markers of IR, insulin resistance, and high blood sugar were all associated with excess risk of adverse outcomes. That is what the article states. But what does all that mean to you? Chronic inflammation and chronic high blood sugar or insulin resistance are the main underlying causal factors in virtually every chronic disease, including heart disease, cancer, diabetes, obesity, Alzheimer's, digestive disorders, depression, and the list goes on and on and on. But the main underlying causal factors of chronic inflammation and chronic high blood sugar are lifestyle choices, how you eat, how you move, and how you think. These are all things that are within your control. Now, I just want to be really clear. No one should try to be perfect in this sugar-eating society that we live in. But being mindful of what you're eating can make a huge difference in your overall health. If you feel that the information in this video is helpful, we would love for you to give it a thumbs up. Share it with a friend, and of course, subscribe to our channel so that you can see all the latest. Synergy Spoke is a non-profit organization with the sole purpose of bringing quality, evidence-based health education to the masses. And of course, if you'd like to see a short clip of today's ride, which is in Moab on the trail called Captain Ahab, I encourage you to stay tuned. I hope you have a healthy, wonderful, and happy day today. This section here, the video does not do it justice, of course. It's pretty steep. It's also pretty chunky, and I've ridden this course maybe half a dozen times, and I've yet to do this little section. It's always scared me. Here we go. I did it. And it's got a little bit of steepness to it. Okay, here we got this little chunky climb, and I made it. Okay, here we go. This little chute I've also never done before. Hooey! I did it. Here we go. Oh, there goes the other one.